Hello to all acupuncture healers. We would have learnt about yin and yang and their implications, and we would have heard about how to differentiate between yin and yang, and we would have been given few initial heads on about yin and yang. Do we actually know how it is going to help us in treating yin and yang? Okay, for the basic things which we had come across, yin is nothing but water, and yang is nothing but fire. Yang is hotness, and yin is coldness. Yang is restlessness, and yin is quiet. Yang is dry, yin is wet. Yang is hard, and yin is soft. So with this, actually we can see whether the muscles have been hardened or softened. If it is hardened, then we can use the yang as to initiate the points by reading the pulse. And if the muscles are soft, then we can say that it is actually the yin meridians which we have to activate. And if there is a dryness in the throat, and if there is a dryness in the skin, and if there is a dryness in the tongue, so this can be treated on the yang meridians based on the pulse. So this is how actually slowly we can get into yin and yang to differentiate. If you see again, yang is excitement, yin is inhibition, yang is rapidity, yin is slowness, yang is non-substantial, yin is substantial, yang is transformation, yin is convergence, yang is change, yin is storage. So these are all the different characteristics of yin and yang which will help us in diagnosing the patients while seeing the pulse. Any lump which is hard is actually yang. Any lump which is soft is yin. So we can deficiency in yang is a hard lump, and a deficiency in yin is again a soft lump. Hyperactive is yang, hypoactive is yin. Rapid movements is yang, and a very slow movement is yin. Walking fast is again yang, walking slow is again yin. Talking fast is again yang, and talking slowly is again yin. So these are all the some of the characteristics which is there in yin and yang. So based on this, actually we can diagnose the patients, and we can just go ahead with the treatments. How far actually we had known about yin and yang? As a healer, the basic stuff when I learned yin and yang is nothing but it's a cold and hot organs. The basic symptoms and few other characters on yin and yang was being taught to us. But do we know exactly what yin and yang can actually do to us? Yang and yin, I can say you about the disease aspects of yang and yin. Acute disease is yang, and chronic disease is yin. Rapid onset is yang, and gradual onset is yin. Rapid pathological changes is yang, and yin is lingering diseases. Yang is again heat, yin is again cold. Yang throws off bedcloths, and yin likes to be covered, likes to be lied stretched is yang, and to curl up is again yin. These are all other few characteristics, and if a person actually shouts a lot and the way they speak is pretty hard and the voice is more of it and it is astounding with the bass, then it is yang. And if the voice is slow and very calm, this is yin characteristics actually. Again, Yang talks a lot, Yin dislikes talking. There is, I mean, as per loud voice and weak voice, Yang is a loud voice and Yin is again a weak voice. So these are all few other characteristics on the Yin and Yang, which actually we can use it for diagnosis purpose. Even though after getting the pulse, whether which part of it should be executed or selected can be actually cross-checked with these characteristics. Like I say, I get a pulse in air and wood. Whether I should treat lung meridian or a large intestine meridian, how we should differentiate it. If there is a dryness and if the throat is dry and I get air and wood, I can take large intestine because hotness actually represents your yang meridians. So this way we can diagnose Yin and Yang and select the point and initiate it will be at the right particular point. So this is how actually we can differentiate between Yin and Yang. Few more other points on Yin and Yang is Yang, you get actually thirst, and no thirst is Yin. Scanty dark urination is Yang characteristics, and profuse pale urination is Yin characteristics. Constipation is again Yang characteristics, and loose stool is again Yin characteristics. You see, the full pulse will be on the Yang side and empty pulse will be on the Yin side. So these are all the few characteristics in which we can diagnose based on the pulse. After reading the pulse, we can drill down to whether to choose Yin meridians or Yang meridians. We can use this diagnosis to actually select a point and initiate it. This is where actually we as a healers lag behind. Hope so this video is helpful for you in diagnosing and executing or selecting your points based on Yin and Yang characteristics through the pulse diagnosis in acupuncture. Thank you. See you with few more other details later.